Hi, my name is Tara Higginbotham. This is my project for HIM 2810C for Julie Shea. It is on home health agencies. Home health agencies are organizations that offer skilled health care in the home for patients. This could be anything from short-term care like wound care or physical therapy services to long-term care for chronically ill patients so they can enjoy a higher quality of life in their own homes for as long as possible. Short-term care would be someone who had a surgery in an outpatient facility who came home instead of going into a skilled nursing facility. And then they have a nurse or a physical therapist come into their home to help them recover. Long-term chronically ill from anywhere from Alzheimer patients to diabetes patients who are trying to stay in the home and outside of a nursing facility. Over the course of this project, I'm going to look at um, home health agencies or HHAs needs and licensure and accreditation requirements. Part of that is the CMS, which is Centers for Medicare and Medicaid Conditions of Participation. Conditions of participation are standards that healthcare organizations, whether they be hospitals or acute care or home health, must meet in order to participate in any of the Medicare and Medicaid programs. The major part of the COP for home health agencies is OASIS, and that is a data set, which means the outcome and assessment information set, and it's a standardized data set to collect information on any patients in the home health agency. The first part of that data set is the start of care, every 60-day follow-up, and discharge. And what OASIS does is it collects data, it sends it to the state level, and then it sends it on to the Medicaid and Medicare programs. What that does is allows a standard for what they have to collect for each patient in order to qualify for their reimbursement or their accreditation through CMS. The other part of home health agencies, in order to operate, they have to fall under, in our state, the Florida statutes. And that's for all their licensure and their accreditation and their business admin. So under the Florida statutes right now, 400.461 through 400.518, they detail all the Florida statutes in regards to home health agencies. One of the examples I have here is 400.464, and it's all HHAs must specify services offered at what skill level they're offered per service. So you have a home health agency, say similar to an elderly care agency, and they offer nutritional or dietary services. But at the same time, they, offer like skilled nursing services. They have to specify exactly what they offer at what skill level they offer. So if they don't have someone who could handle wound care, they can't offer that service and maintain their license. The other part of 400.464 is that even though you have like a main HHA office, every satellite office, every different branch also has to maintain a separate license for the operating office. So that means that the people working in the different branch offices also have to work under a different, they have to be licensed to work in that office as well. HHAs and your documentation. Our clinical documentation, regardless if you're in a hospital, acute care, ambulatory, any kind of setting of the health industry, is the backbone. You have to have documentation to get reimbursement, to prove everything that you're doing, to prove that you're taking care of a patient. Documentation is going to be needed. Under the Florida Statute 400491, it states that all clinical documents must be maintained for each patient who receives skilled care and a clinical record that includes pertinent past and current medical, nursing, social, and other therapeutic information, treatment orders, and other such information as it is necessary for the safe and adequate care of the patient. When home health services are terminated, the record must show the date and the reason for the termination. Such records are considered patient records under 400494 and must be maintained by the home health agency for 6 years following termination of services. Now I'm going to stop here because there's a very interesting thing. CMS and their conditions of participation under their guidelines only require records be kept for 5 years. But because Florida has a longer retention period, we keep them for the 6 years under that. And also, if any patient ever transfers to their home health, a copy of his or hers has to be provided to the other home health agency. So it's like if you were staying in a hospital or a nursing facility and you transfer to a different facility, your records would be able to be transferred with you. They would be able to get a copy of those. So that's what that statute pertains to for your documentation standards. Again, at the top of the slide, I've reiterated that the CMS guidelines specify an actual shorter retention period for records, but because Florida statutes are longer, we're going to keep them for the longer period. If that had been reversed, we would still maintain them for whatever the longer period, whether the Medicaid or Medicare or the state that's requiring which one. The Centers for Medicaid and Medicare all maintains that all clinical documentation under their interpretive guidelines has to show the plan of care. The record needs to contain the appropriate identifying information for patient, name of physician, drug, dietary, treatment, and activity orders. It needs to be signed and dated, clinical and progress notes, and copies of summary reports sent to the attending physician that's actually in charge of the HHA patients, and discharge summary when the patient gets ready to be discharged out of home health. And the biggest reason you need clinical documentation is for reimbursement. For reimbursement, you need to show treatment. You need to show services provided, time services were provided, and any progress notes to substantiate the claims that services were provided. On all your clinical documentation, when people come into your home, now they generally come in with tablets or electronic devices where the patients can sign instead of having paper-based records. And that's where you get your electronic signatures when they flop over. So things can get automatically sent back to the office. They can be filed appropriately. For your reimbursement, in the next, I think, slide or two, we're going to get to some of the actual codes that are used in home health. And they would be used for those purposes to show this is why someone came in. They came in for wound care. They came in for speech therapy. They came in for dietary services. They came in for elderly care. And that would allow the HHAs to get reimbursement. As I said before, this is one of the codes for HHA. There really aren't any ICD-10 codes because they are inpatient codes, but there is HCPCS Level 2 codes and they are CPT codes. Some of the CPT codes are 99341 through 99350 that are used for home visit. And each of those codes can be used with other codes out of the CPT, especially when I'm talking about like wound care or speech therapy services. One of the codes from the before mentioned would be used to say, hey, this is a home visit. And then you would list the subsequent codes underneath that to list what exactly, how much time was spent on each service provided. Some of the HCPCS Level 2 codes, they have multiple codes from medical equipment to, social services. One of the codes that I have listed here is G0155. And it's actually a clinical social worker in the home health or hospice setting for 15 minutes. and it's listed under the temporary procedure codes, but it's at the discretion of the carrier whether or not it will be covered. Just to reiterate how easy it is to find some home health agencies, the most reliable source is actually from CMS, and it is Home Health Compare. I've shown a picture at the side here, but you can Google it or click on the link on the PowerPoint, and it'll take you there, and it'll bring up elderly care, home health care. There is like HSP. Another one that's advertised a lot is care.com. And it does everything from babysitting, and it has some nursing available through there for their licenses as a home health agency. Just to let you know, home health agencies or, skilled services for nursing that you can get in your home. They're required to be accredited. They have to have licensure under state. They have to meet the COP to hit Medicare and Medicaid to participate in those programs. Um, and I urge you to look them up. Thank you for listening and have a wonderful day.